Good afternoon. The chairman of the Presidential Task Force on COVID-19 Response and Secretary to the Government Health Federation, honorable ministers and members of PTF, the national coordinator, the country representative of WHO, permanent secretaries, directors, ladies and gentlemen. As of today, the 27th of August 2020, we have recorded 53,021 COVID-19 positive cases out of 391,502 samples tested, while 40,281 persons have been treated and discharged. Sadly, we have lost 1,010 persons to the virus, with a case fatality rate that remains at about 1.9%. The global trend in figures is unrelenting and progressing as many countries seek the best way to preserve lives while relieving the pressure on their economy. It is critical to find a delicate balance between the two sides, as some countries who have miscalculated this equilibrium were forced to change their ways and retrace their steps, or suffer a second COVID-19 wave after reopening their economy. We are continuing with plans to reduce case fatality rate to less than 1% by optimizing response activities and cooperating with states according to the challenges they face, which includes a review of the status of the treatment centers, isolation centers, and ICUs. To this end, a grand virtual meeting with all CMDs and medical directors of federal hospitals in Nigeria is scheduled for next week. A new state molecular laboratory is currently being optimized in Kebbi and Bayelsa, while gene expert machines have been set up at National Hospital Abuja and University of Abuja Teaching Hospital Gwagwalada, as was announced some weeks ago, which means that suspected COVID-19 emergencies can now be diagnosed on site within 1 hour. And you have the result. And this will drastically reduce the turnaround time and waiting time to allow better utilization of observation rooms in the hospitals. This is a major advancement in handling the distress experienced by patients arriving as emergencies in these hospitals who will normally have to wait for a day or two before they get their result. The University of Abuja Teaching Hospital in Gwagwalada has also found access to supplementary medical oxygen supply, courtesy of the generosity of the Nigeria Air Force, who supplies them with oxygen from their plant in Yola. On Tuesday, the 25th of August 2020, Africa was certified polio-free, having passed through the formal standardized certification process, where Nigeria was the last of 47 member states of the African region to meet the criteria. These include no wild poliovirus detected in the last 4 years in Nigeria, but also an obligation on us to faithfully adhere to keeping and expanding routine immunization and active disease surveillance and containment. This achievement was made possible with the strong commitment of the President of the Federal Republic, who personally vaccinated his own grandchild to openly demonstrate that those few drops of vaccines are not harmful but life-saving. His Excellency also delivered a virtual keynote address at the formal event and accepted the certification as a fulfillment of his own promise that he would not bequeath a polio endemic country to his successor. We are appreciative and proud of this achievement of being polio-free, and I thank the staff and management of National Primary Healthcare Development Agency for all their efforts and sacrifice. We shall not relent in our efforts to ensure that Nigeria remains polio-free. We shall be deploying the material and human resource assets from the polio eradication effort to surveillance and fighting other disease outbreaks, including the fight against COVID-19 pandemic. Nigeria also participated in the World Health Organization African Regional Conference, held virtually due to the demands of the time and chaired by the Minister of Health of the Congo. I led the Nigerian team and participated in discussions which centered around various subjects, including COVID-19 and progress made in conversations around vaccines and implementing the African Regional Sickle Cell Strategy. We shall sustain our interest in development around COVID-19 vaccine as the world seeks opportunity, and discuss with other countries as the world seeks opportunities to exchange ideas with countries and organizations investing in new knowledge. Training and retraining on infection prevention and control is ongoing in all our facilities, as well as ensuring availability of personal protective equipment as an investment to continue the reduction in health worker infection. I renew my call on all our health workers to ensure judicious and prudent use of these PPE materials while observing their full IPC measures. Finally, I wish to remind all of us that COVID-19 is still with us and might be for a foreseeable future till there is a vaccine available for it. We are exploring options and opportunities to see that when the vaccines are available, Nigeria will be among the beneficiaries. The NAFDAC is also pursuing, trying to reach the international maturity level to assure that the products and processes that come out of research work in Nigeria towards development of vaccine candidates are realizable and that they meet the required standards. With the imperative to reopen the economy, relax local and international air travel to support restoration of livelihood, the experience in other countries is that we must all be vigilant and do all that is possible not to lose our attention to preserving lives or to lose the gains we have made over the months. The onus lies not only on government, but it's a shared responsibility with the populace. The safest, easiest, cheapest option of achieving a balance between saving livelihoods and saving lives remains adherence to non-pharmaceutical measures, as we have preached so many times. With these measures, we can balance our indices, we can balance and uphold our indices even as we reopen our economy. Thank you for your attention.